Hey there, Teresa here. Thanks for joining me. I'm Teresa Yunkin, and I'm the founder and CEO of an AI-driven wellness app called Mosaic Life and a Health Informaticist. I try to bring together the business and IT sides of healthcare to help healthcare organizations build solutions that benefit everyone in the healthcare ecosystem. Welcome to the first episode in our summer series, which is a FHIR 101 session. Let's dive into the essentials of FHIR in a way that's easy to understand. Whether you're new to the concept or just need a refresher, this episode will help you understand what FHIR is and why it's a game changer for healthcare interoperability. What exactly is FHIR? FHIR, pronounced FHIR, stands for Fast Healthcare Interoperability Resources. It's like a universal translator for healthcare data. It allows different healthcare computer systems to talk to one another. Imagine your healthcare data moving from your PCP to your orthopedist, whether they are in the same health organization or not. It's just like how people from different countries communicate using a common language. Like a person from France and a person from Italy speak English and they can understand each other. Technically, FHIR is a standard for exchanging healthcare information electronically. It was developed by Health Level 7 International, often referred to as HL7. But don't worry about the details, just know that it makes sharing healthcare data much easier. One other term you need to know is the definition of an API. An API, which stands for Application Programming Interface, is a way for different software apps to communicate and share information with each other. Think of it as a messenger that allows two applications to talk to each other and exchange data in a predefined, agreed upon, and secure manner. For example, imagine you're using a weather app on your phone. The app itself doesn't create or own the weather data. Instead, it sends a request to a weather API. The API then retrieves the relevant weather information from a database and sends it back to your app in a format that your app can understand and display to you. Healthcare data uses APIs in the same way. Now let's talk about why should you care about FHIR. First and foremost, it has been written into federal rules, so you need to know it deals with how data gets back and forth using an API. In the context of healthcare, APIs like the Patient Access API, also known as CMS-9115, and the Prior Authorization Support API, known as CMS-0057, enable different health IT systems, such as electronic health records, insurance company systems, and patient-facing healthcare apps, to communicate and share data seamlessly. The goal of making healthcare organizations address healthcare data and flexibility using FHIR is because FHIR supports new tools like mobile health apps, telehealth services, and wearable devices. This makes patient care more interactive and continuous because you have the data you need to serve your patients, and FHIR APIs allow real-time data retrieval. Now, let's understand 3 ways how FHIR and AI together can revolutionize healthcare. Number 1 is enhanced data utilization, because AI can quickly process and analyze vast amounts of data. You can provide relevant information a provider needs to know at that moment to improve patient outcomes. FHIR standardizes data, making it easier for AI algorithms to work their magic. Number 2 is improved predictive analytics. So, if you can imagine predicting health issues before they become critical with AI's predictive power and FHIR's data exchange, proactive care becomes a reality. FHIR enables comprehensive data access, and this access to data can improve AI's ability to predict potential health problems more accurately. Finally, number 3 is personalized treatment plans. This means you can tailor treatments for individual patients, which can lead to better health outcomes and higher patient satisfaction. AI analyzes diverse data sources made available through FHIR APIs to process the data and can recommend the most effective treatments for each patient. In summary, FHIR and AI can transform healthcare by making data sharing happen in a safe and agreed-to manner, which allows each computer system the ability to use the data more effectively. This combination of data sharing and regulatory direction, like the CMS rules, is paving the way for a more connected, efficient, and patient-centered healthcare ecosystem. I encourage you to interact with us throughout this summer series. Ask questions, share your thoughts, and let us know what you hope to learn. Use the hashtag AI in healthcare and tag us on social media to join the conversation. Next week, we'll dive into how you can inspire patient engagement with AI. Thank you for joining us today. I'm excited to embark on this journey with you. Make sure to follow my LinkedIn page for updates and share this series with anyone interested in healthcare technologies. I'll catch you next week on the flip side.